The term anterior ventral or posterior dorsal are used to indicate the front and the back of the body respectively.
Anterior, posterior.
To describe the relationship of two structures, one is said to be anterior or posterior of the other, insofar as it is comparatively closer to the anterior or posterior body surface. The nose is the nose is on the interior side of the head, interior, whereas the buttocks 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 are on the posterior side of the body. In describing the hand and the term palmar or dorsal palmar or dorsal surface are used in place of interior or and posterior respectively. The describing describing the foot, the term plantar surface refers to the sole of the foot, and dorsal surface indicates the upper top surface, a structure situated nearer to the medial plate of the body than another is said to be medial to the other. Similarly, a structure that lies further away from the medial plate that other is said to be lateral on the other hand. The eyes are lateral to the nose. The nose is medial to the eyes. In terms superior cranial cephalic and inferior caudal donate levels relatively high or low with reference to the upper and the lower ends of the body, i.g., the head is the superior end of the body, whereas the feet are the inferior end of the body. The terms proximal and distal describes positions relative to the core root or attached end of a reference point. Proximal is closer to the core and distal is farther away from the core, i.g., the upper limb, the shoulder is proximal to the elbow and the hand is distal to the elbow. The term superficial and deep donate denote positions relative to the surface and the body or a given structure. Superficial is closer to the surface, whereas deep is farther away from the surface, i.g., the skin is superficial to the ribs, but the heart is deeper than the ribs. The term interior and exterior are used to describe locations relative to this center of a structure or space. Internal is inside the structure and external is outside the structure. The thoracic cavity is an internal space in the trunk of the body, whereas the skin is the external layer of the trunk. Ipsilateral and contralateral are terms referring to positions relative to a reference side of the body. Ipsilateral is on the same side as the reference point, and contralateral is on the opposite side from the reference point, i.g., the right eye is ipsilateral to the right ear. The right eye is ipsilateral to the right ear, wherever the right eye is contralateral to the left ear. The spine position of the body is lying on the back. The prone position is lying face downward. The term afferent and efferent refers to the direction of flow relative to a reference point. Afferent is flow towards the reference point, whereas effect is flow away from the reference. Venous blood flow is afferent to the heart. The arterial flow is efferent to the heart. Terms relative to movement. In the musculoskeletal system, movement takes place at the joints. A joint is a site where two or more bones articulate or come together. Some joints have no movement structure or the skull. Some have only slight movement, superior tibiofibular joint, and some are freely movable, i.g., the shoulder joint. Figure 1.2. Some Anatomic terms used in relation to movements. Note the difference between flexion and elbow versus the knee. Flexion is the movement which a joint angle is decreased closed during motion occurring in a sagittal plane. Sagittal plane. Extension is the opposite movement of in which the joint angle is increased, opened, straightened in a sagittal plane. IG flexion of an elbow approximates the anterior surface of the turn to the anterior surface of the arm extends to the elbow is the reverse motion. Flexion usually is an interior movement, but it is occasionally described posterior, as in the case of knee joint. Also, flexion typically implies a relative more powerful anti-gravity movement directed towards the embroic ventral aspect of the body.
Dorsiflexion or plantar flexion are special terms used to simplifying description of the movements of the foot. Dorsiflexion, the equivalent to the extension, refers to lifting the top of the foot superiorly. Dorsiflexion, forward the shin. Plantar flexion, the equivalent the flexion, refers to moving the sole of the foot, as in standing the toes. This is points that become clear in the following chapter of the back and limbs. Lateral flexion is the imprecise following chapters on the back and limbs. Impaired terms sometimes used in clinical settings that are referred to the sideway behind bending movement of the trunk to the coronal plane. However, the abduction is the more correct term, on the other hand, should be used. Additional anatomic term. Abduction is the movement away from the midline of the body in the coronal plane. Adduction is the movement of the forward middle of the body in the coronal plane.
Plan C. Fig 1.2. The fingers and the toes.
In the fingers and toes, abduction is applied to the spreading apart of the digital, and the adduction is applied digits and applied to the drawing together of this structure. The movement of the thumb, which are more compliant and described in chapter 3. Inversion or eversion. Inversion is a special term used to describe the certain movements of the foot. Inversion is the turning
of the sole to the foot so that the sole faces in an medial direction towards the middle line, and eversion in the opposite movement of the foot so that the sole faces the lateral direction. Rotation is the term applied to the movement of a part of the body round its long axis with little to no movement through space. Medial intraoral rotation is the movement that results in the anterior surface of the part facing medially, and lateral external rotation is the movement that results in the anterior surface of the part facing laterally. Circumduction is a complex sequence of movements combining flexion, extension, abduction, adduction, and rotation. The overall movement results in transcribing a chord through space, with the apex of the cone being the more proximal critical cavity of a joint, and the base of a cone being the more distal end of a bone, a limb segment. Circumduction is most easily and efficient at the shoulder. Pronation and supination are special movements of the forearm in which the radius moves around the ulna.
Pronation.
Pronation is
Supination.
turning Pronation is turning from forearm medial in a such manner that the palm of the hand faces posteriorly, and spination is a turn that the forearm laterally form the pronated position so that the palm of the hand comes to face interiorly. These movements are composed of both rotation at the proximal end of the radius and circumduction at the distal end of the radius. Some references describe pronation, supination of the ankle of the foot. Clinically defined, pronation and supination of the foot are complex movements of ankle region that include plantar flexion, dorsiflexion, eversion, and inversion. Pronation and the supination of the forearm or ankle very different movement that should not be confused with one another. Protraction is the term used to describe moving a body part forward. Retraction a part is to move a part backward. Examples of these movements are the forward and the backward movement of the jaw in the temporomandibular joints, as when jointing the chin forward, and the forward backward motion of the scalp across the rib cage, as when reaching forward. Eponyms. Fascia is the connective tissue that encloses the body deep to the skin and also envelops and separates individual muscle groups of muscle as well as deeper organs. Think of fascia as the connective tissue threads that hold the structure of the body together in organized arrangements. The fascia of the body can be divided into two types, the superficial and the deep. The superficial fascia or subcutaneous tissue is a mixture of loose areolar and adipose tissue. It unites the dermis of the skin to the underlying deep fascia. The superficial or the subcutaneous surface is a mixture of loose areolar and adipose tissue that unites the dermis of the skin to the underlying deep fascia in the scalp, the back of the neck, and the palm of the hands and the soles of the feet. It contains numerous bundles of collagen fibers that hold the skin firmly to the deeper structure. In the eyelids, auricle of the ear, penis, and scrotum, and clitoris. It is devoid of adipose tissue. It is biceps artery figure 1.6. Section through the middle of the right arm shows the arrangement of the superficial and the deep fascia. Note that how deep indentation of the deep fascia extend between groups of muscles and form intermuscular septa that divide the arm into fascial compartments. It merely is a thin film of aerial tissue covering the muscles and the aponeuses. In the limbs, it forms a definite stretch around the muscles and the other structure, holding them in form a definite stretch around the muscles and other structure. Fibrous septa extends from the deep surface of the membrane between the groups of muscles and in many places divide the interior of the limbs into compartments in the region of joints, and in deep fascia may be considerable thick end of the form restraining bands called retinaculia, and their function is hold merely tendons in position or to serve as pullers around which the tendons can move. Extensor tendons and their synovial sets. Extension retinaculum. extensor retinaculum of the posterior surface of the wrist holding the underlying tendons of the extensor muscle in position. Clinical notes: fascie and infection. Knowledge of the arrangement of the deep fascie often helps explain the path taken by an infection which spreads from its primary site. For example, in the neck, the various fascial plates determine how infection can extend from the region of the floor to the mouth and the larynx of the frame of the base of the skull into the thoracic cavity. Bone. Bone is a living tissue capable of changing its structure when subject to stress. The other connective tissues, bone consists of cell, fibers, and matrix. It is hard because the calcification of its extracellular matrix and process of a degree of elasticity because of the presence of organic fibers. Bone has a protective function. For example, the skull and the vertebral column protect the brain and spinal cord from injury, and the sternum and ribs protect the thoracic and upper abdominal viscera. It serves as a layer as seen in the long bones of the limbs as an important storage area for circulum salts. Internally, bone houses the protect and delicate blood forming bone marrow. Figure 1.8. The skeleton, interior view, lateral view with most of the upper limbs removed. A thick layer of fibrous tissue called the periosteum covers the bone surface. Other than the articular surface, the periosteum has an abundant vascular supply, and the cell of its deeper surface and osteogenic. The periosteum is particularly well united to bone at the site where muscles, tendons, and the ligaments are attached to the bone. Bundles of collagen fibers known as Sharp's fibers extend to the periosteum into the underlying bone. As periosteum receives a rich nerve supply and is very sensitive to trauma. Bone exists into two forms: compact and cell compact and cancellous. Compact bone appears in solid mass. Cancellous bones consist of branches of networks of tubercle. The tubercle are arranged so as to provide resistance against the mechanical stress and strains.
সেকশন অফ দ্য ডিফারেন্ট টাইপস অফ বোন। লং বোন, এটা লং বোন হিউমারাসের, আর এটা হচ্ছে ইরেগুলার বোন ক্যালকেনিয়াম, এটা ক্যালকেনিয়াম। তারপরে হচ্ছে ফ্ল্যাট বোন। ফ্ল্যাট বোন, টু প্যারাইটাল বোনস সেপারেটেড বাই দি সেজিটাল সুচার, এই সেজিটাল সুচার। তারপর হচ্ছে সিগময়েড বোন, প্যাটেলার সিগময়েড বোন, এই যে আমাদের হাঁটুর এই প্যাটেলার সিগময়েড বোন, এটা হচ্ছে note the arrangement of the trabeculae to act as stators of reset both compression and tension forces in the upper end of the femur. Bone classification. Bones can be classified regionally or according to their general shape. In the regional classification scheme, the bones are organized into two main groups: the axial and the appendicular skeletons. The axial skeleton consists of the elements forming the central axis of the body, and the appendicular skeleton consists of the bones forming the upper and lower limb girdle of the extremities. বুঝছো? তার হচ্ছে রিজনাল ক্লাসিফিকেশন অফ বোনস। অ্যাক্সিয়াল স্কেলেটন, স্কাল, ক্রেনিয়াম, আটটা। দেখো, অ্যাক্সিয়াল স্কেলেটন, অ্যাপেন্ডিকুলার স্কেলেটন, এটা হচ্ছে অ্যাক্সিয়াল স্কেলেটন হচ্ছে ক্রেনিয়াম, আটটা বোন, ফেস 14টা বোন, অডিটরি অসিসিস, ছয়টা, হাইওয়েট হাইওয়েট একটা, ভার্টিব্রার ইনক্লুডিং স্যাক্রাম অ্যান্ড কক্সিস 26টা, স্যাক্রাম একটা, রিবস 24টা, অ্যাপেন্ডিকুলার স্কেলেটন ইজ দি শোল্ডার গার্ডলস 2টা, স্ক্যাপুলা 2টা, আপার এক্সট্রিমিটিস 2, হিউমারাস 2, রেডিয়াস 2, carpals 16, metacarpals 10, and the phalanges 28. Pelvic girdle os cocci 2. Lower extremities femur 2, patella 2, fibula 2, tibia 2, tarsals 14, metatarsal 10, and phalanges 28. Total bone 206. In the general shape classification, scheme bones are organized into 5 categories: long, short, flat, irregular, and sesamoid. Long, short, flat, irregular, sesamoid. Long bones. Long bones are found in the limbs, the humerus, femur, metacarpal, metatarsal, and the phalanges. Their length is greater than their breadth. See the figure. They have a tubular shaped, the diaphysis, usually the epiphysis, at the each end. During the growing phase, the diaphysis is separated from the epiphysis by the epiphyseal cartilage. The part of the diaphysis that lies central marrow cavity lies adjacent to the epiphyseal cartilage. The part of the diaphysis and lies adjacent to the epiphyseal cartilage is called the metaphysis. The shaft has a central marrow cavity containing bone marrow. The outer part of the shaft is composed of compact bone that is covered by the periosteum. The ends of the long bones are composed of cancellous bones surrounded by a layer of compact bone. The articular surfaces of the ends of the bones are covered by hyaline cartilage. Short bones. Short bones are found in the hand and foot. The scaphoid, lunate, talus, and the calcaneum. There are short bones কি হচ্ছে scaphoid, lunate, talus, and the calcaneum. They are roughly cubital in shape and are composed of the cartilaginous bones surrounded by a thin layer of compact bone. Short bones are covered with periosteum and the articular surface are covered by hyaline cartilage. Flat bone. Flat bones are found in the vault of the skull, the frontal parietal bones. They are composed of thin and inner outer layers of the compact bone, the tables, separated by a layer of the cancellous bones. The the scapula, although irregular in shape, and are incubated in this group. Irregular bones. Irregular bones included those are assigned to the previous groups. Assigned to the previous groups, the bones of the skull, the vertebra, and the pelvic bones. They are composed of a thin shell of compact bone with an interior made up to the cancellous bones. Sesamoid bone. A sesamoid bone is one formed with a tendon where the tendon passes over a joint. The greater part of the sesamoid bone is buried in the tendon and the surface is covered by cartilage. The largest sesamoid bone is patella, kneecap, which is located in the tendon of the quadriceps femoris, C. brevis, on the thumb, in the thumb, and the flexor hallucis brevis in the big toe. The function is sesamoid bone is reduce friction on the tendon. It can also alter the direction of pull of tendon.
Bone surface markings. The surface of the bone typically shows various surface markings or irregular features. The surface is raised or roughened when bands of fascia, ligament, tendon, and apnoeus are attached to the bone. These roughness are not present at birth. They appear at puberty and become progressively more obvious during adult life. The pull of these fibrous structures causes the periosteum to elevate and new bone to be disposed beneath. It contains in certain situations the surface markings are large and are given special names. Some of the more important markings are summarized in table 1.2. Bone surface markings: lines, ridge, crest, tubercle, protuberance, tuberosity, malicious, trochanter, spine or spinous process, styloid process, head, condyle, facet, notch, epicondyle, groups of sulcus, fossa, foramen, canal, meatus. Each of the following chapters provide a comprehensive description of the bones that the region of their significance feature. Do not relegate learning this material to a painful exercise in rote memorization of meaningless words. Try to understand the terminology in order to better appreciate the application of the anatomy. Most importantly, ask yourself function questions when you examine the bones themselves, such as is this a right or a left element. This articulates with the structure area. The attaches to this structure. Is this structure parable? Can this structure be identified as a standard radiography image? Are there any important nervovascular relations to this region or structure? Bone or bone marrow. Bone marrow occupies the marrow cavity of the long and the short bone of the intercells of cancellous bones in float and irregular bones. The marrow of all the bones of the body is red and hematopoietic at birth. These blood forming activities gradually lessen with age, and the red marrow is replaced by yellow marrow. Yellow marrow begins to appear in the distal bones of the limbs at the age of about 7 years. This replacement of marrow gradually moves proximally, so that by the time the person becomes an adult, red marrow is restricted to the bones of the skull, the vertebral column, and thoracic cage, the girdle bones, and the head of the humerus and femur. Bone development by two processes, membranous and endochondral. In membranous formations, the bone develops directly from a connective tissue membrane. In endochondral formations, a cartilaginous model is the first laid down and is later replaced by bone. Consult a textbook of histology or embryology for details for the cellular changes involved. The bones of the valid of the skull develop rapidly by membranous functions in the embryo, and this serves to protect the underlying developing brain. In at birth, small areas of the membrane persist between the bone. This is important clinically because it allows the bone to a certain amount of mobility so that the skull can undergo molding during its descent through the female genital progress. Undergo molding during the descent through the female genital passage. The bone marrows of the limbs developed by endochondral ossification is a slow process. It is not completed until the age of 18 to 20 years, even later. This central of the bone formation found in shaft of the bone is the diaphysis. The certain at the end of the bones are epiphyses, the plane of cartilage at each end lying between the epiphysis and diaphysis is a growing bone. This is epiphyseal plate. The metaphysis of the part of the diaphysis that abuts into the epiphyseal plate. Clinical notes: bone fractures. Immediately after a fracture, the patient suffers severe local pain and is not able to use the injured part. Deformity and may be visible if the bone fragments have been displaced relative to each other. The degree of deformation and the direction taken by the bone fragments depend not only on the mechanism of injury but also on the pull of the muscles attached to the fragments. Ligaments and attachments also influence the deformity. In certain situations, for example, the ilium fracture results in a deformity because the inner and the outer surface of the bone are splinted by the extensive organs of the muscles. In contrast, a fracture of the neck of the femur produces considerable displacement. The strong muscles of the high pull the disfigurement upwards so that the leg is shortened. The very strong lateral rotations rotate the distal fragment laterally so that the foot points laterally. Fracture of a bone is accompanied by a considerable hemorrhage of blood between the bone ends and into the surrounding soft tissues. The blood vessels and the fibroblasts and osteoblasts from the periosteum and the endothelium take part in the repair process. Rickets. Rickets is a diffractive mineralization of the cartilage matrix in a growing bone. This produces a condition in which the cartilage cells continue to grow, resulting in excess cartilage and a widening of epiphyseal plates. The poorly mineralized cartilaginous matrix and the osteoid matrix are soft and they bend under the stress of the bearing weight. The resulting deformities include enlarged costochondrial junctions, bowing and the long bones of the lower limbs, and bossing of the frontal bones of the skull. Deformities of the pelvis may also occur.
Epiphyseal plate disorder. Epiphyseal plate disorder affected only children and adolescents. Affect adolescent মানে বয়সন্ধিকালে, children মানে বাচ্চা. The epiphyseal plate is the part of the growing bone concerned primarily with epiphyseal plate with growth in length. Trauma, infection, diet, exercise, endocrine disorder can disturb the growth of the hyaline cartilage plant, leading to deformity and loss of function. In the femur, for example, the proximal epiphysis can slip because of the mechanical stress or excessive loads. The length of the limbs can increase excessively because the increased vascularity in the region of the epiphyseal plate, secondary to infection or in the presence of tumors. Shortening of the limb can follow the trauma to the epiphyseal plate, resulting from a diminished blood supply in the cartilage. Then cartilage. Cartilage is a form of connective tissue in which the cells and fibers are embedded in a gel-like matrix. The fibers retain firmness and the resilience. A fibrous membrane called the perichondrium covers the cartilage except on the exposed surface in joints. Of the three types of cartilage, hyaline cartilage, fibrocartilage, tend to classify or even ossify in the later life. Hyaline cartilage has a high proportion of the amorphous matrix that has the same refractive index as the fibers embedded in it. Throughout childhood and adolescence, it plays an important part in the growth in length of the long bones. Epiphyseal plates are composed of the hyaline cartilage. It has a great resistance to wear and covers the articular surface of nearly all synovial joints. Hyaline cartilage is incapable of repair. When the fractured, the defect is filled with fibrous tissue. Fibrocartilage has mainly collagenous fibers embedded in a small amount of matrix and is found in the discs within joints, the temporomandibular joint and the sternoclavicular joint and knee joint, on the articular surface of the clavicle and mandible. Fibrocartilage is damaged, repairs itself slowly in a manner similar to fibrous tissue elsewhere. Joint discs have a poor and blood supply and therefore don't repair themselves when damaged. Elastic cartilage processes large numbers of elastic fibers embedded in matrix, making it flexible. It is found in the auricle of the ear and the external auditory meatus, the auditory tube, and the epiglottis. Elastic cartilage, if damaged, repairs itself with fibrous tissue. Joints, a site where two or more bones come together, whether or not movement occurs between them, it is termed a joint. Joint classification. The three main types of joint are based on the tissue that lie in the joint space between the bones: fibrous joints, cartilage joints, and synovial joints. Example of the three types: fibrous joint, এগুলো হচ্ছে fibrous joint, এগুলো হচ্ছে বি হচ্ছে কার্টিলেজ জয়েন্ট, এই কার্টিলেজের মাধ্যমে হচ্ছে ই দিয়ে জয়েন্ট হয়, আরটা হচ্ছে সাইনোভিয়াল জয়েন্ট। এবং fibrous joint, in fibrous joint the articular surface of the bones are tightly linked by a fibrous tissue that fills with joint space. Thus very little movement is possible on this joint. The structure is the vault of the skull, and the inferior trabecular joint are example of the fibrous tissue. দেখাগুলো কি দেখতেছো? In fibrous joint, the articular surface of the bones are tightly linked by fibrous tissue that fills the joint space. Thus, very little movement of possible as this joint. কি?
Fibrous joints. In fibrous joints, the articular surface of the bone are tightly linked with fibrous tissues that fill the joint gap. Thus, a very little movement is possible in these joints. The structure of the valve of the skull and the inferior tubofibular joints are examples of fibrous joints. Cartilage joints. In cartilage joints, the space between the articulating bone surface is filled with a cartilaginous pad. The two types of cartilage joints are synchrodrons and symphysis. A synchrodrosis is a cartilaginous joint in which the articulating bones are united by a plate or bar of hyaline cartilage. The epiphyseal plate between the epiphysis and the diaphysis of a growing bone is a temporary form of synchrodrosis. The first sternocostal joint between the first rib and the manubrium sterni is a permanent synchrodrosis. No movement occurs in synchrodrosis. A symphysis is a cartilage joint in which the bones are united primarily by a pad or a plate of fibrocartilage. Symphyses are located along the midline of the body, the intervertebral joints between the vertebral bones. The manubristeral joints and the symphysis pubis are symphyseal joints. A small amount of movement is possible in symphysis. Synovial joints. In synovial joints, the articulate surface of the bone are covered by a thin layer of hyaline cartilage and are separated by a fluid-filled joint cavity. This arrangement permits a large degree of freedom of movement. In cavity of the joint is lined by a synovial membrane which extends from the margin of one particular surface to those of the other. A, a tough fibrous membrane referred to as the scapula of the joint protects the exterior of the synovial membrane. A viscous fluid called synovial fluid, in which is produced by the synovial membrane, lubricates the articulate surface in certain synovial joints, i.e., knee joints and the temporomandibular joints. Disc and wedges of fibrocartilage are interposed between the articular surface and the bones. These are referred to as articular bones. Some synovial joints, the hip and the knee joints, contain fatty pads lying between the synovial membrane and the fibrous scapular bone. The shape of the bone participating in the joint and the proximal approximation of the adjacent anatomic structures, i.e., the thigh against the anterior abdomen wall of the flexing of the hip joint, and the presence of fibrous ligaments uniting the bones of all contribute to limiting the degree of movement in a synovial joint. Most ligaments lay outside of the joint scapula and referred as extracapsular ligaments. However, some important ligaments, i.e., the circulatory ligaments of the knee, lie within the capsule and are termed intracapsular ligaments. Synovial joints can be classified according to the shape of the articular surface and the type of movement are possible, and summarized the types of synovial joints. The examples given are not necessarily the only joints of each type. Table 1.3 Synovial joint types.
Plain joint, the opposed articular surface are flat and almost flat, permitting the bones to slide on the another multiple directions. Example: joints between the articular process of the vertebra, sternoclavicular joint, acromyoclavicular joint. Hinge joint. They resemble the hinge on a door. On that uniaxial flexion, extension, movement of the possible. Flexion, extension, movement of the possible. The ulnar joint in the elbow, interphalangeal joint in the hands and the feet, ankle, talocalcaneal joint. Pivoid joint, a central bony pivoid is surrounded by a bony ligamentous ring. Rotation is the only movement of possible. Median and atlantotoxial joint and superior radioulnar joint. Condyloid joint, two distinct convex surfaces that articulate with the two concave surfaces. Biaxial movements of the two plants are typical. Metacarpopharyngeal joints in the hand and knuckle joints and feet. Ellipsoid joint, an elliptical convex articular surface feeds into the elliptical concave articular surface. Mainly biaxial movements are allowed. The radiocarpal joint, the saddle joint, the articular surfaces are reciprocally concave, convex, and resemble a saddle on a horse's back, and multixual movement allows. The carpometacarpal joint in the thumb. Ball and socket joint, a ball-shaped head on the one bones feeds into the socket like the concavity to other, allowing the mallexial movement. The genohumeral অথবা shoulder joint, hip joint. শেষ। এবার এখন ছবিগুলো দেখো। Example of the different type of synovial joint. Synovial joint দেখো, ওটা রাখো না।
রেকর্ড হচ্ছে তো।
Joint, hinge joint, humeral joint, radiocarpal part of the wrist joint, saddle joint, metacarpal joint of the thumb, ball and socket joint, hip joint. Joint stability. The stability of a joint depends on the three main factors: the morphology of the bone's articular surface, ligaments, and the bone muscle around the joint. তাহলে কি কি? Articular surface, ligaments, and the tone of the muscle around the joints. The three main factors responsible for establishing the simple articular surface, ligaments, and the muscle tone. Articular surface. In certain joints, the shapes of the bones of their articular surface causes the bones to form a relatively tight-fitting framework that importance overall stability of the joint, such as the ball and socket arrangement of the hip joint and the mortise arrangement of the tarsal bones in the ankle joint. However, in same other joint, the shape of the bones contributes the little and nothing of the joint stability. The acroclavicular or the calcocuvate and the knee joint ligaments. Fibrous ligament prevent exercise movement of the joint, but if this stress is continued for an excessively long period, then the fibrous ligament strains. For example, the ligaments of the joints between the bones forming the arches of the feet with not supported of the weight of the body. Should the tone of the muscles that normally support the arches become impaired by fatigue, then the ligaments of the with stress and the arches of the carpals producing flat feet, elastic ligaments conversely return to their original length after the stretching. The elastic ligaments of the auditory ossicles play an active part in supporting the joints and assisting in the return of the bones of their original position after movement. Muscle tone. In most joints, muscle tone is the major factor connecting stability. For the example, the muscle tone of the short muscle around the shoulder joint keeps the hemisphere head of the humerus of the shoulder girdle cavity of the scapula. Without the action of this muscle, very little force would be required to dislocate this joint. The knee joint is very unstable without the tonic activity of the quadrifemoris muscles. The joint between the small bones forming the arches of the feet, largely supported by the tone of the muscle of the leg, whose tendons that inserted into the bones of the feet.
Clinical notes. Joint examination. When examining a patient, the clinician should assess the normal range of movement of all joints. When the bones of a joint are no longer in their normal anatomic relationship with one another, then the joint is said to be dislocated. Some joints are particularly susceptible to dislocation, such as the neck of support by ligaments and poor shape of the articular surface or the absence of adequate muscle support. The shoulder joints, temporomandibular joint, and the acromicroclavicular joints are good examples. Dislocation of the hip is usually congenital, being caused by inadequate development of the socket that normally holds the head of the femur firmly in position. The presence of cartilaginous disc within joints, especially weight-bearing joints, as the cage of the knee makes the disc particularly susceptible to injury in spots. During a rapid movement, the disc loses its normal relationship to the bones and becomes crushed between the weight bearing surface. In certain diseases of the nervous system, synchromonial, the sensation of the pain is joint is lost. This means that the warning sensation of the pain felt when a joint moves beyond the normal range of a movement are not experienced. This phenomenon results in the destruction of the joints. Knowledge of the classification of the joints is valuable because, for example, certain diseases affect only certain types of joints. Gonococcal arthritis affects large synovial joints such as the knee, elbow, and the wrist, whereas tuberculous arthritis also affects synovial joints and may start in the synovial membrane or in the bone. Remember that more than one joint may receive the same nerve supply. For example, the abductor nerve supply both the hip and the knee joints. Thus, a patient with disease limited to one of the joints may experience pain in both ligaments.
A ligament is a cord or band or fibrous connective tissue. United cord, band, or fibrous connective tissue uniting two or more structure. Ligaments are two more structure. In the cortex of the musculoskeletal system, ligament typically bind bones at joints. The two types of ligaments are fibrous and elastic. Fibrous are elastic. Most not stretchable under normal condition. The iliofemoral ligaments of the hip joint and the collateral ligaments of the elbow joint. Elastic ligaments are composed largely to elastic tissue and can therefore remain their original length after stretching. The ligamentum flavum and the vertebral column are the calcaneonavicular ligaments of the foot.
Joint stability. The stability of a joint depends on three main factors: the morphology of the bone, articular surface, the ligament, and the tone of the muscle around the joint. Figure 1.1.2. The three main factors responsible for stabilizing a joint: the shape of an articular surface, ligaments, muscle tone. Articular surface. In certain areas, the shape of the bone and their articular surface cause the bone to form a relatively tight fitting framework that imparts overall stability to the joint, such as the ball and socket arrangement of the hip to joint and the mortise arrangement of the tarsal bone in ankle joint. However, in some of the joints, the shape of the bone contributes little or nothing to joint stability. The acromyoclavicle, calcaneocoid, and the knee joints. Ligaments. Fibrous ligaments prevent excessive movements in a joint, but if the stress is continued for an excessive long period, the fibrous ligaments stretch. For example, the ligaments of the joint between the bones forming the arch of the feet will not support the weight of the body. Shoulder and the tone of the muscles that normally support the arches become impaired by fatigue, and the ligaments will stretch and the arches will collapse, producing flat feet. Elastic ligaments, conversely, return to their original length after stretching. The elastic ligaments of the auditory ossicle play an active part in supporting the joints and assisting in the return of the bones to their original position after movement. Muscle tone. In most joints, muscle tone is the major factor controlling stability. For example, the muscle tone of the short muscle around the shoulder joint keeps the hemispherical head of the humerus in the shallow glenoid cavity of the scapula. Without The action of these muscles with very little force would be required to dislocate these joints. The knee joint is unstable without the tonic activity of the quadriceps forming muscles. The joint between the small bones forming the arch of the feet are largely supported by the tone of the muscle of the leg. Those tendons are inserted into the bones of the feet. Joint nerve supply. The joint capsule and the ligaments receive an abundant sensory nerve supply. The sensory nerve supply is a joint also supplies the muscles moving on the joint and the skin overlaying the insertion of these muscles, as a fact that has been codified as Hilton's law. Clinical notes. Joint examination. When examining a patient, clinical the clinician should access the normal range of movement of all joints. When the bones of the joint are no longer in their normal anatomic relationship with one another, then the joints is said to be dislocated. Some joints are particularly susceptible to dislocation because of lack of support by ligaments or poor shape of articular surfaces or the absence of adequate muscle support. The shoulder joints, temporomandibular joint, and acromicrovicular joints are good examples. Dislocation of the hip is usually congenital, being caused by inadequate development of the socket that normally holds the head of the femur firmly in position. The presence of cartilaginous discs within joints, especially weight-bearing joints, as in the knee, as in the case of the knee, makes the disc particularly susceptible to injuries in sports during a rapid movement. The disc loses its normal relationship to the bones and becomes crushed between the weight-bearing surfaces. In certain diseases of the nervous system, e.g., syringomyelia, the sensation of pain in a joint is lost. This means that the warning sensation of pain felt when joint moves beyond the normal range of the movement are not experienced. This phenomenon results in the destruction of the joints. Knowledge of the classification of joints is valuable because, for example, certain diseases affect only certain types of joints. Gonococcal arthritis affects large synovial joints such as the ankle, elbow, or waist, whereas tuberculous arthritis also affect synovial joints and may start in the synovial membrane or in the bone. Remember that more than one joint may receive the same nerve supply. For example, the abductor nerve supply both in hip and knee joints. Thus, a patient with disease limited to one of these joints may experience pain in both. Ligament damage. Joint ligaments are very prone to excessive stretching, tearing, and rupture. A ligament sparing in an injury caused by abnormal or excessive force at a joint but without dislocation of the joint or fraction of a bone. In treating damaged ligaments, if possible, the opposing damage sacrifices the ligament are brought ligament surfaces of the ligament are brought together by positioning and immobilizing the joint. In serious injuries, surgeon approximation of the cut and may be required. The blood clot at the damaged site is inhibited by blood vessels and fibroblasts. The blasts lay down new collagen and elastic fibers which become oriented along the line of the mechanical stress. Bruises and synovial sheaths. A bruiser is a closed fibrous sac lined intentionally with synovial membrane. The synovial membrane secretes a film of viscous fluid that fills the sac. Bruces are typically found in areas subject to friction and serve to reduce friction, i.e., wherever tendons rub against bones, ligaments, or other tendons. Synovial is around long tendons. Figure 1.13 examples of bruise and synovial sets. A4 burrs related to the front of the knee joint. Note that the suprapelvic bruise communicates with the cavity of the joint. Synovial sets around the long tendons of the figure. How a tendon indents a synovial set during development, and blood vessels reach the tendon through the mesotendon. A synovial set is a tubular bursa that surrounds a tendon. A tendon invaginates the bruise from one side to the tendon becomes suspended with the bruise by a mesotendon. The mesotendon enables blood vessels to enter the tendon along its course. In certain situations, when the range of the movement is extensive, the mesotendon disappears or remains in the form of narrow threads. The vincula long flexor tendon of the finger and toes. Synovial sets occur when tendons pass under ligaments and retinacula and through osteofibrous tunnels. The function is to reduce function. The function is to reduce friction between the tendon and its surrounding structures. Clinical notes: bruise and synovial set, trauma and infection. Bruise and synovial set are commonly the site of trauma or infectious disease. Brucitis is inflammation of a bruise. Inflammation of the prepatella brusa, the housemaid's knee, may occur in the result of trauma from repeated knee of hard surface. Tenosynovitis is inflammation of a tendon and its synovial set. The tendon set of the hand may become inflamed after excessive or unaccustomed not used unaccustomed use. Notable tenosynovitis may lead to constriction of the synovial set and obstruct efficient sliding of the tendon. Muscle. There are three types of muscle: skeletal, smooth, and cardiac. Skeletal muscle generally acts to produce the movement of the skeleton. They are sometimes called voluntary muscles and are made of strained muscle fibers. A skeletal muscle has two or more attachments. The more proximal, less mobile attachment is referred to as the origin. The more distal and the more mobile attachment is the insertion. When a muscle contracts, the insertion is drawn proximally toward the origin. However, under various circumstances, the degree of mobility of the attachments may be reversed. Therefore, origin and insertion are relative terms.
Skeletal muscle generally act to produce the movement of the skeleton. They are sometimes called the voluntary muscle and are made up of straight muscle fibers. A skeletal muscle has two or more attachment. The more proximal, less mobile attachment is referred to as the origin. The more distal, more mobile attachment is the insertion. The more distal and more mobile attachment is the insertion. When a muscle contracts, the insertion is drawn proximally toward the origin. However, under varying circumstances, the degree of mobility of this attachment may be reversed. Therefore, origin and insertion are relative terms. এই অরিজিন আর ইনসারশন শেষ। অরিজিন এখান থেকে, ইনসারশন এখান থেকে। বেলি gastro
Conemius,
gastrocnemius
gastrocnemius muscle.
gastrocnemius muscle. তারপর হচ্ছে the fleshy part origin insertion belly of the gastrocnemius muscle. Fleshy part of the muscle is referred to as its belly. The ends of the muscle are attached to support the elements, bones, cartilage, ligaments of other muscle by cords of fibrous tissue and called the tendons. Cords of fibrous tissue কাকে বলে tendon. Some tendon of those belonging to the flat, wide abdominal or oblique muscle from a thin, strong sheet termed as an aponeurosis. Other tendons may form a raphe, which is an indigitation of the tendinous ends of the fibers of the flat muscles. এই দেখো এগুলো হচ্ছে রিবসের মাসেল common tendon for the insertion of the gastrocnemius and soleus muscle. Common tendon. আর হচ্ছে external oblique aponeurosis. Raphe of the myelothyroid muscle. The example of a tendon, aponeurosis and raphe. Skeletal muscle internal structure. Individual muscle fibers are bound together with continuous delicate sheath of alveolar tissue, which are condensed on the surface of the muscle to form a fibrous envelope. The epimysium investing deep tissue. The individual fibers of a muscle are arranged either parallel or oblique to the long axis of the muscle. Because a muscle fiber shortens by 1/3 to the half of its resting length, when it contacts muscle, those fibers run parallel to the line of pull, while act over a long distance and bring about a greater degree of movement compared with those whose fibers run obliquely. That is, parallel fiber muscles have a greater excursions, a greater range of motion. The sternocleidomastoid, rectus abdominis, and serratus muscles are examples of muscles with parietal fiber arrangement. Different from the interlaced of the skeletal muscle, the relaxed and the contracted muscle are also shown. Relaxed muscle are contracted muscle. How the muscle fibers are contraction shortened by 1/3 of the 1/2 of their resulting length. Note also how the muscle swells.
How the muscle fibers on contraction shorten by 1/3 to 1/2 of their resting length. Note also how the muscle swells. Muscles whose fibers run obliquely to the line of pull are referred to as pennate muscles, i.e., they resemble a feather. In a appennate muscle, in a unipennate muscle, the tendon lies along one side of the muscle and the muscle fibers pass obliquely to it. Extensor digitorum longus. Whereas in a bipennate muscle, the tendon lies in the center of the muscle and the muscle fibers pass to form two sides. Rectus femoris. A multipennate muscle may be arranged as a series of bipennate muscles lying along one another, e.g. acromial fibers of the deltoid of may have the tendon lying within its center and its muscle fiber passing to it from all sides, converging as they, e.g. tibialis anterior. The force strength that a muscle produces when it contracts is directly proportional to the physiological cross-section R of the muscle, i.e. to the total cross-section area of the muscle fibers. Pinnate muscles have a great number of fibers per given volume of the muscle substance and thus a greater cross-section area compared to parallel fiber muscles. Therefore, pinnate muscle produce more fiber but have less excretion. Skeletal muscle action. All movements are the result of the coordinate action of many muscles, but studying each muscle individually is necessary to understand their action. A muscle may work in the following four ways: agnostic, ag- agon- agno-
Agonist,
agnostic,
agonist,
agonist, agonist, agonist,
prime mover.
prime
A
mover,
muscle is the agonist prime mover when it is the chief muscle of the member of the chief group of the muscle responsible for producing a particular movement. The quadriceps femoris, for example, is the agonist in the movement of the extending the knee joint.
Figure 1.1-17. Different types of muscle action. A. Quadriceps femoris extending to the knee as an agonist prime mover and bicep femoris action as an agonist. B. Bicep femoris flexing the knee as an agonist and quadriceps acting as an antagonist. C. Muscles around shoulder girdles fixing the scapula so that movement of abduction can take place at the shoulder joint. Flexor and extensor muscles of the carpus acting as synergists and
Synergesis and
stabilizing the carpus so that long flexors and extensors tendons can flex and extend the fingers. Antagonistic. Any muscle that opposes the action of the agonist is an antagonist, such as the biceps femoris, which is an antagonist during knee extension because it opposes the action of the quadriceps femoris. Before a prime mover can contract, the antagonist muscle must be equally relaxed.
relieved.
Relaxed. This is brought about by nervous flexing inhibition. Remember that these terms describe movements relative to each other. Therefore, the bicep femoris becomes an agonist and the quadriceps femoris becomes the antagonist during knee flexion. Flexor.
Flexor.
Flexor. A flexor contracts isometrically, i.e., contraction increases the tone but does not itself produce movement. To stabilize the origin of the shoulder girdle to the trunk, contract as flexors to allow the deltoid to act on the shoulder joint. Synergies. In many locations in the body, the agonist muscle crosses multiple joints before it reaches the joint at which its main action takes place. To prevent unwanted movements in an intermediate joint, muscles called syringes contract and stabilize the intermediate joints. For example, the flexor and extensor muscles of the corpus contract to fix the wrist joint, and this allows the long flexor and the extensor muscles of the fingers to work efficiently. Remember, these terms are applied to the role of a particular muscle during a particular movement. Many muscles can alter their roles and act as an agonist, an antagonist, a flexor, or a synergist from movement to movement. Depending on the movement to be accomplished, muscles can also act paradoxically, e.g.,
Example, the
the
bicep is
biceps brachii. A flexor of the elbow joint may contract and modulate the rate of extension of the elbow when the triceps brachii contracts. Skeletal muscles nerve supply. The nerve trunk to a muscle is a mixed nerve. About 60% of the nerve fibers are motor and 40% are sensory. 40% are sensory. Also, the nerve contracts some sympathetic automatic fibers. The nerve enters the muscles at about the midpoint on its deep surface, often near the margin. The point of entrance is known as the motor point. This arrangement allows the muscles to both protect its nerve trunks and move with minimum interference with the nerve trunk.
individual motor neurons within a muscle nerve supply a variable number of the muscle fibers that are arranged in a very well spatial spatial distribution. A single motor neuron pulse all the muscle fibers innervated by the neuron constitute a motor unit. The size of the motor unit, the number of the muscle fibers supplied by a motor neuron, varies greatly from the muscle to muscle. Several hundred muscle fibers per neuron are characteristic of the large trunk and lower limb muscle. Small motor neurons, as few as 5 to 10 muscle fibers per neurons, are feature of the precision movement muscles such as the extraocular muscles and the small muscle in the hand. Skeletal muscle naming. Individual muscles are named according to the shape, size, number of the heads of the or bellies, position, depth, and attachment or actions. Some example of the muscle names are shown in the table 1.4. Pay attention to the names of the muscle and try to understand their names, which convey a great deal of information that will enable better understanding and reduce rote memorizations. Skeletal muscle naming. Deltoid, triangular, teres, round, rectus, straight, major, large, latissimus হচ্ছে ব্রডেস্ট, তারপর হচ্ছে লঙ্গিসমাস হচ্ছে লংগেস্ট, বাইসেপস টু হেড মানে কি বুঝেছে, ডেল্টর মানে ট্রায়াঙ্গুলার মাসেল, ট্রেরিস মানে রাউন্ড, রেক্টাস মানে স্ট্রেইট মাসেল, মেজর মানে লার্জ, ল্যাটিসমাস মানে হচ্ছে ব্রডেস্ট, লাইজিমাস লংগেস্ট, তারপর হচ্ছে বাইসেপস টু হেডস, কোয়াড্রিসেপস ফোর হেডস, ডাইজেস্টিক হচ্ছে টু বেলিস, পেক্টোরালিস অফ দি চেস্ট, সুপারস্টেনিয়াস হচ্ছে অ্যাবাভ দি স্প্যানাস স্ক্যাপুলা, তারপর হচ্ছে ব্র্যাকাই হচ্ছে অফ দি আর্ম, প্রোফান্ডাস হচ্ছে ডিপ, তারপরে সুপারফেশিয়ালিস হচ্ছে সুপারফিশিয়াল, এক্সটার্নাস হচ্ছে এক্সটার্নাল, sternocleidomastoid, 4 sternum and clavicle to mastoid process, caracobrachialis, 4 caracoid and process of the arm, extensor from the extensor মানে extensor, flexor মানে flex, আর constrictor মানে constrict. These names are commonly used in combination, for example, flexor pollicis longus, long flexor of the thumb.
Smooth muscle. Smooth muscle consists of long spindle-shaped cells closely arranged in bundles of sheaths. In the tubes of the body, it provides the motive power of propelling the contents through the lumen. In the digestive system, it also mixes indigested food with digestive juices. A wave of contraction of the circularly arranged fibers pass along the tube, milking the content onward. By their contraction, the longitudinal fibers pull the wall of the tube proximally over the contents. This method of propulsion is referred to as peristalsis. In storage organs such as the urinary bladder and the uterus, the fibers are irregularly arranged and interlaced with one another. Their contraction is slow and sustained and brings about expulsion of the content of the organs. In the walls of the blood vessels, the smooth muscle fibers are arranged circularly and serve to modify the caliber of the lumen. Depending on the organ, smooth muscle fibers may be stimulated to contract by the local stretching of the fibers, by nerve impulses from, from autonomic nerves, or by hormonal stimulations. Cardiac muscles consist of
Stratified muscle fibers.
striated muscles fibers that branch and unite with each other. It forms the myocardium of the heart. It, its fibers tend to be arranged in whorls and spirals, and they have the property to spontaneous and rhythmic contraction. Specialized cardiac muscle fibers from the conducting system of the heart. Cardiac muscle is supplied by autonomic nerve fibers that terminate the nodes of the conducting system and the myocardium in the myocardium. Clinical notes: muscle tone. Determining the tone of a muscle is important in clinical examination of a muscle is flaccid than flaccid than the afferent and efferent or both nerve involved in the reflex arc necessary for the production of muscle tone have been interrupted. IG. If the nerve trunk to a muscle is severed, both nerves will have been interrupted. If polymyelitis have involved the
Has
major
involved the major
anterior horn cells at the level in the spinal cord that
intravenous
interferes the muscle,
intervenes.
the efferent motor neurons will not function. Conversely, if the muscle is found to be hypertonic, the possibility exists of a lesion involving higher motor
Neurons.
neurons in the spinal cord or brain. Muscle attachments. By knowing the main attachments of all the major muscles of the body, understanding the normal and abnormal actions of individual muscles or muscle groups become possible. Without this information, clinicians cannot even attempt to analyze the example a patient's abnormal
Gait.
gain
হাঁটা abnormal হাঁটা
gait,
এই যে আমি এখনো
muscle
হাঁটছি না যে
shapes and
একটু
forms.
পর্যন্ত হ্যাঁ
Also note the general shape and form of muscles. A paralyzed muscle or one that is not used, such as occurs when a limb is immobilized in a cast, quickly atrophies and changes shape. In the case of the limbs, remember that a muscle on the opposite side of the body can be used for comparison. Cardiac muscle necrosis. Cardiac muscle receives its blood supply from the coronary arteries. A sudden block of one of the large branches of a cardiac artery will inevitably lead to necrosis of the cardiac muscle and often to the death of the patient. Nerve system. The nerve
যাচ্ছি।
system, together with the endocrine system, control the integrate and the activities of different parts of the body. The nervous system is divided into two main parts: the central nervous system, which consists of the brain and spinal cord, and the peripheral nervous system, which consists of a paired series of cranial and spinal nerves and their associated associated ganglia. Functionally, the nervous system can be further divided in the somatic nervous system and the autonomic nervous system. The somatic nervous system acts upon the body's external movement, primarily through consistently perceived sensory glands from the body wall and limbs. The
আচ্ছা।
automatic nerve system ANS action upon the body's internal environment, primarily through the action of smooth muscles, cardiac muscles, and glands, and used mostly in voluntary responses to sensory signals that are not consciously consciously perceived.
বাই।
Basic anatomy. Basic anatomy is the study of minimal anatomy of consistent with the understanding of the overall structure and the function of the body. The skin is divided into two parts: the superficial part and the epidermis, and the deep part, the dermis. The epidermis is a stratified epithelium with cells that flatten as they mature and rise on the surface. On the palms of the hands and the soles of the feet, the epidermis is extremely thick to withstand the wear and the tear that occurs in these regions. In other areas of the body, such as the anterior surface of the arm and forearm, is thin. The dermis is composed of dense connective tissues containing many blood vessels, lymphatic vessels, and nerves. It shows considerable variation in thickness in different parts of the body, tending to be thinner on the anterior than the posterior surface. It is thinner in women than in men. It dermis. The dermis of the skin is connected to the underlying deep fascia or bone by the superficial fascia, otherwise known as subcutaneous tissue. Staff of hair, epidermis, dermis, and superficial fascia. Body, acrine sweat gland, duct of acrine sweat gland. Figure: general structure of the skin and its relationship to the surface superficial fascia. Note that hair follicles extend into the deeper part of the dermis or into the superficial fascia, whereas sweat glands extend deeply into the superficial fascia. The skin over joints always folds into the same place. The skin creases at their sides. The skin is thinner than anywhere else, and it firmly threatens to underlying structure by strong bonds of fiber tissue. The skin creases, nail folds, nail root, nail bed, temporal planx. Figure 1.5. The various skin creases on the palmar surface of the hand and the anterior surface of the waist joint. The relationship of the nails to the structure of the figure is also shown. The appendages of the skin are the nails, hair follicles, sebaceous glands, and sweat glands. The nails are car- keratinized plates on the dorsal surface of the tips of the finger and toes. The proximal edge of the plate is the root of the nail, with the exception of the distal edge of the plate. The nail is surrounded and overlapped by folds of skin known as nail folds. The surface of the skin covered by the nails is the nail bed. Hair grows out of the follicles, which are invaginations of the epidermis into the dermis. The follicles lie obliquely to the skin surface and their expanse extremities called hair bulbs penetrate to the deeper part of the dermis. Each hair bulb is concave at its end, and the concavity is occupied by vascular connective tissue called the hair papilla, a band of tissue muscle. The anterior papilla connects the undersurface of the follicle of the superficial part of the dermis. The muscle is innervated by sympathetic nerve fibers, and its contraction causes the hair to move into a more vertical position. It also composes the sebaceous glands and causes it to extrude some of its secretions. The pull of the muscle also causes damping of the skin surface, so-called goose flesh, the goose pimples. Here are distributed in the palms and hands and the sides of the fingers. The glands, penis and clitoris, the labia minora and the internal surface of the labia majora, and the soles of the sides of the feet and the sides of the toes. Sebaceous glands create sebum into the shaft of the hair as they pass up through the neck of the follicles. They are situated on the sloping surface of the follicles and lie within the dermis. Sebaceous is oily material that helps preserve the flexibility of the emerging hair. It also oils the surface epidermis around the mouth of the follicle. Sweat glands are long spiral tubular glands distributed over the surface of the body, except on the red margins of the lips and the nail beds, and the glands penis and clitoris. These glands extend through the full thickness of the dermis, and their extremities may lie in the superficial fascia. The sweat glands are therefore the most deeply penetrating structures of the epidermal appendages. Clinical notes: skin infections, the nail folds, hair follicles, and sebaceous glands are common site for pathogenic organisms such as Staphylococcus aureus and enter into the underlying tissue. Interfering occurring between the nail and the nail folds is called a paronychia. Paronychia. Infection of the hair follicles and the sebaceous gland is responsible for the common boil. A carbuncle is a staphylococcal infection of the superficial fascia that commonly occurs in the nape of the neck and usually starts as infection of a hair follicle or group of hair follicles. Sebaceous cyst. A sebaceous cyst is caused by obstruction of the mouth of a sebaceous duct that may be caused by damage of a comb or by infection. It causes most frequently on the scalp. Shock. A patient who is in a state of shock is pale and has goose flesh as a result of overactivity of the sympathetic system, which causes vasoconstriction of the dermal arteries and constriction of the anterior pili muscles. Skin burns. The depth of the burn determines the method and the rate of healing. A partial thickness burn heals from the cells of the hair follicles, sebaceous glands and sweat glands, as well as from the cells at the edge of the burn. A burn that extends deeper than the sweat glands heals slowly and from the edges only. The fibrous tissue of the margins of the burn causes considerable construction of the wound. A deep burn often is grafted in order to speed up healing and reduce the incidence of contracture. Skin grafting. The two main types of skin grafting are split thickness and full thickness grafts. In a split thickness graft, the greater part of the epidermis, including the tips of the dermal papillae, is removed from the donor site and placed on the recipient site. This leaves the epidermal cells on the side of the dermal papillae, and the cells of the hair follicles and sweat glands at the donor site are repair purposes. A full thickness graft includes both the epidermis and the dermis, and the requires rapid establishment of a new circulation within it at the recipient site to survive. The donor site is usually covered with a split thickness graft. In certain circumstances, the full thickness graft is made in the form of a pedicle graft, in which a slope of full thickness skin is turned and stitched in the position of the recipient site, leaving the base of the flap with its blood supply intact at the donor site. Later, when the newborn blood supply is graft has been established, the base of the graft is cut across.